Hi everyone, I'm James Yeager. The problem I'm looking at in this presentation is access to affordable healthcare in the United States and why universal healthcare would be a viable solution. I'm going to kind of outline where we're at now in the United States with our healthcare, how other countries do healthcare, and why that might be a good way to solve the problem. So with that being said, let's get started. So the current problem we have is access to affordable health care. It's a law now that you have to have health care. If you don't have it, you'll be fined come tax time. Um, Looking at debt people have, looking at credit card debt, monthly bills associated with owning a home or living in an apartment, auto loans, all those sources of debt combined still don't overtake medical debt, which is a huge problem. So one instance, one medical emergency or one trip to the doctor, prescriptions, that could easily trump all of anyone's debt and could really put them in a huge hole that they're not able to climb out of. Looking at this chart here, the largest category of debt that people face, the amount, ranges from $2,000 to $5,000, which is quite a bit considering student loans, mortgages, and other bills. So the current system we have is a mixed system. So there's a public option where people can go shop on the marketplace online through the Affordable Care Act if they don't have employer-provided health insurance. That's with rising costs, having an employer plan that's affordable is kind of unheard of nowadays. Looking at the spending sources, we see that health insurance covers the bulk. 12% seems kind of small for out of pocket, but when you factor in those costs, it really adds up over time, as that chart showed on the last slide. Here's kind of a breakdown of how our system operates. We have state and local taxes and federal taxes that cover Medicaid, Medicare, kind of like welfare programs. People that make a certain amount a year, the elderly, and then we have private employers that kind of have a deal with companies like Medical Mutual. So they're private health insurers that will money gets taken out of your paycheck weekly or monthly, and you'll have like a copay when you go see your doctor or go to the emergency room. So the current system we have is the Affordable Care Act, which was passed in 2010. For people that don't have employer-provided health insurance, they can go online through the marketplace, and there's quite a few plans they can choose from with varying monthly premiums, deductibles, and while this seems good, depending on how much money one makes, it kind of determines how much they're going to be paying monthly, how much they're going to be paying out of pocket before that plan kicks in. So here's a breakdown of the plans. I like to look at this kind of as a comparison to car insurance or home insurance, which many people are familiar with. So looking at the bottom of the chart, under 30 years old, I tend to think of that as like incidental insurance when it comes to like car insurance. If you're under 30, you're probably not going to be making as many trips to the doctor or going to need a huge operation that's going to be very costly. So your monthly premium is going to be low. But the setback there is if you do have an incident where you need care, your deductible is going to be high. So you're going to be paying out of pocket, quite a bit more out of pocket before that insurance kicks in and covers the rest. And then moving from bronze all the way up to platinum, the lower your premium, the lower you pay monthly, the higher your deductible is going to be out of pocket before that insurance kicks in, as you can see. So where do we go from here? The European Union, which has a bunch of countries kind of comparable to the states in the United States. You can go anywhere in the EU and pretty much you're guaranteed healthcare because it has been established as a fundamental right, just like the right for free speech here, to bear arms here, kind of looking at it in that manner. We are one of the few nations that does not guarantee this as a right, and because of that, we have one of the lowest life expectancies among high-income countries, and also the highest rates of avoidable deaths. So many people think the United States is a world leader in pretty much every facet. When we look at healthcare, that's not really the case here. So looking at other countries that we can follow that have proven universal healthcare to work, Germany might be a good segue because there are both private and public options. So it's not too drastic of a change if we were to make it. This is kind of income-based as well. So those making less than $67,000 a year are required to enroll in the public option. And looking at that chart to the right, 88% of people are covered. There's private coverage with the remaining 11%. And then there's complementary coverage, that 10.6%. It's kind of supplemental. If you think of elective stuff that you might want to be seen for, that's where that's going to come into play. England's another good example. I know a lot of people say that it's a lot smaller than the United States, but I kind of look at England as maybe you could compare this to a couple states combined, and we could operate universal health care, like leave it to the states to take care of their people. So it's guaranteed by the government. A lot of people say it's free when you go to the doctor. You don't get a bill. When you get a prescription filled, it's free. I think free should be used loosely here because a lot of that is covered through taxes. But people can still purchase supplemental insurance if they want to cover elective things, elective procedures, if they want to be seen faster. And it's guaranteed in the Constitution. There's no discrimination. Like I said before, healthcare is a right of the people. And looking at this chart here, 100% of the public is covered. And that private coverage, that supplemental coverage, is only 10.5%, which is a pretty small number in comparison. And it leads me to believe that the people in England are satisfied with their coverage. So this video kind of covers the basis of what the national healthcare system in England is.
The National Health Service has been called the closest thing the British have to a religion. Ever since its creation in 1948, it's held a special place in the national psyche, and right from the beginning its workforce has been drawn from all over the world. The one thing most non-Brits know about the NHS is that it's free. So if you visit the doctor, it's free. If you need an operation, it's free. Having a baby is free. Parking at the hospital is... Actually, they charge you for parking at the hospital. But if you get hit by a car and need to go to hospital by ambulance, it's free. While the NHS may be free to use, it's not actually free. Next year's health budget will be something like £140 billion. The total cost works out to about £2,000 per year per person, which sounds a lot, but it's actually quite low by international standards. In the US, for example, per capita healthcare spending is more than double that. The NHS may be one of the most efficient health services in the world, but it's also a sprawling entity. UK-wide, there is a baffling array of NHS bodies. Over 500 clinical commissioning groups, health boards and hospital trusts, about 8,000 GP surgeries, plus the voluntary sector, private providers, and others. It also has numerous separate bodies for regulation, training.
So I think an important point there to look at is about $2,000 a year per person, and if you factor in that the average monthly premium in the United States through the ACA is about $438 a month, that seems like a pretty good deal to me. $2,000 a year per person, and everything else is free on top of that. Scandinavia has a good system. Looking at the countries of Norway, Sweden, and Denmark, you could also consider Finland and Iceland in there. Taxes, again, cover the bulk of the costs here. The big thing with the Scandinavian countries is they are focused on taking care of each other. They are not selfish, and all these countries are always ranked in the top 10 happiest countries. That list that always comes out. So that's another factor to consider. Here's a breakdown of coverage. All three countries have 100% coverage. Looking at Sweden, the supplementary coverage is 6%, which is really low. So a lot of people are satisfied with their healthcare there. Denmark is kind of different. Dental and vision is not really covered, and that is shown in the supplemental categories there with the 42% and 30%. So I think it's pretty clear the path forward is establishing healthcare as a right for everyone. There's a variety of ways to accomplish affordable, accessible healthcare for everyone. And I think it boils down to having everyone's best interest at heart. Everyone's situation is different. And if we move towards this system, everyone will be better in the long run. Here's a list of my sources. I hope I was able to inform all of you on the current system we have, why it's flawed, and why there are much better opportunities out there for everyone. Thanks.